This is something that nurses have been voicing concerns about for a very long time and have been, one of them said, this is my biggest fear. And unfortunately, that fear has come to fruition.
A patient died while waiting for treatments in the emergency department at the Health Sciences Center on Monday. In an email statement to City News, a spokesperson for Shared Health Rights, while privacy legislation prevents us from speaking to specifics of a patient case, we are able to confirm that we are investigating a potential critical incident that occurred during a 1-hour window on February 27 in the HSC Winnipeg Emergency Department.
It is evident in every facility in this province. We definitely have a nursing shortage that is critical at this point.
Darlene Jackson, who's the president of the Manitoba Nurses Union, says due to patient overcrowding and a lack of healthcare workers, oftentimes nurses aren't able to keep their eyes on every patient at all times.
We have the beds. We don't have the nurses to care for patients in those beds. So those beds are closed. Patients remain in the emergency department. And then it's just a domino from there.
On Wednesday, Health Minister Audrey Gordon announced that nearly 350 already trained healthcare workers from the Philippines will soon be making their way to Manitoba. But when it came to addressing wait times, she referenced a PSA campaign to divert patients away from emergency departments.
You saw the billboards all over the city. We talked about that last year in terms of educating individuals about where they should be for the right type of care that they need.
And when challenged on whether she was putting the fault on patients, she walked away. What followed almost immediately after were statements from both Manitoba's NDP and Liberal leaders.
If you show up in an ER, you should be cared for. And that's what folks who work in those centers want to deliver. And any elected official in Manitoba should be matching that commitment and certainly not running away from accountability questions.
I keep hearing from people across Manitoba, in Winnipeg, in rural Manitoba, in the north. They're praying that they don't get sick and that they don't have to go to a hospital because they don't think they're going to be safe there.
Jackson says recruiting more nurses is a step in the right direction, but the bigger focus should be on retaining the ones that are already here.
Even if they are able to hit their target of 300 nurses, it is, a drop in the bucket. And we need every nurse that's in the system to stay in the system.
In Winnipeg, Sweet Arasi, City News.